Yeah, today we have with us very senior professionals from Foster Development Homeopathic Medical College and a very unique topic, that is the pharmacological and physiological actions of Rhus Tox. So we have Dr. Ranjana Deshmukh madam, Dr. Archana madam, and Dr. Sakeena madam, who will be our panelist for this discussion. Now I would like to invite Dr. Ranjana madam to start the session.
Very good afternoon, one and all. Good afternoon, Ayesha madam, and all the teachers who have added. So today we have selected this topic, that is physiological and pharmacological action of Rhus Tox. So before going that, we should see what is pharmacology, because there are few students who must have not completed the topic of pharmacology. So it is nothing but it is a branch of science which deals with the action of drug, that is knowledge of drug and action of drug. So it is having two branches, pharmacology, that is pharmacognosy and pharmacodynamics. Pharmacognosy is nothing but knowing or having the knowledge of drug. So regarding, I don't talk about other drugs, but if you see Rhus Tox, what happened?
Ma'am,
please share the PPT.
Our panelists will answer at the end of the session.
No, I am asking for the PPT which is not being shared yet.
Okay.
Yeah, please share the PPT on screen, ma'am.
Okay.
So we will continue. If we come to see the Rhus Tox plant is a strong plant, but still it needs support, and that's why when we use our drug, that is Rhus Tox, even our muscles and tendons becomes weak. That time we apply this Rhus Tox. We prepare medicine from a matured leaves of this Rhus Tox plant, which is having different active constituent present in leaves. And that's why here, if we see pharmacognosy, here we have written that the alkaloid present in leaves is in more amount than the other part. But still, Rhus Tox whole plant contains different active principles. And it is seen that in crude form, the lethal dose is 50 milligram per kg. So it is one of the irritative plants. Some people, they get reactions with this plant. So if we go to see the doctrine of signature, as the plant grow in damp weather, it is no doubt it is a wild plant. It is not available easily any place. It is southern east countries plant. When it grows in less sunlight and in damp weather. So similarly, patient is having the complaint, that is aggravation in damp weather and the damp situation. Some patients, they get easily rashes after touching the plant. So mostly when we go in wild places, some people, they wear full clothes and they go, because it is on touch, it causes irritation, redness, and patient becomes restless. And when we see that the patient is also having restlessness, but when they continue, they feels better. That is what the doctrine of signature. So it is having the active principle, that is mainly not a specific alkaloid, but it contains ursolol, which is a main constituent with different flavonoids, glycosides, and tannins. This ursolol is a mixture of catechol derivatives, which is a hydrocarbon in chains. And it is a plant which is toxic, irritant in properties, also contains different volatile substances, which are toxicodendric acid and rhinogenic acid. If we go to see what are the action of Rhus Tox on different parts, that is sphere of action, if we see, it is seen on the musculoskeletal system, the joints, skin, mucous membranes, and even in cases of fevers, we apply or we administer Rhus Tox. Rhus Tox is having different actions on human organisms, like that is anti-inflammatory, anti-edematous, analgesic, antioxidant, or immunomodulatory actions, or anti-arthritic actions. But before going these actions, I want to tell you that you should know the physiology before going a pharmacological action. So, Aisha madam, I would like to continue this physiological action with our next speaker, that is Sakeena madam. Thank you very much.
I would like to invite Dr. Sakeena madam to continue explaining about the physiological action.
Good afternoon, everybody. Thank you so much. We move ahead. Ma'am, can you change the slide? Actually, we,
Yes.
as Ranjana Deshmukh ma'am has talked about the anti-inflammatory, anti-edematous, etc. properties that we are going to talk about. So we're going to consider the physiological aspect of it. So the first thing that we talk about is the inflammation. Inflammation, definition and all, yeah, that's fine. But I just want to go into a daily life episode and say that, say you like a mango season and you want to eat the mango and you're cutting the mango, and instead of the mango you cut your finger, and the cut finger, that shows in an hour or two, the changes that you see on your finger is nothing else except inflammation. So it's a protective complex biological response by the body tissues to harmful stimulus, and the stimulus the process of inflammation basically aims at eliminating the cause of injury. It can be either in the form of the injury that we talked about, or the disease, or some irritant, and the body aims at clearing out the dead cells, the necrotic cells, and repair of the tissues. Inflammation can either be acute or chronic. As you are seeing in the diagram, it is showing the inflammatory process. We would not go into so much of details. The time is not permitting us so much, so we move ahead with the next slide. As I said, when you cut your finger, what do you see in an hour or two? There is redness at that part, there is slight heat at that part, the area swells up, there is swelling, there would be pain, and there would be loss of function, where you are not able to use your finger, the part that we have talked about. And why are the cardinal signs happening or occurring? Because of the key events that are occurring in inflammation, that is vasodilation, which results in the redness and the heat. The increased vascular permeability, this is because of the chemical mediators of inflammation that we are going to talk about soon after. They result in the swelling and the exudation and then the swelling. And of course, there is going to be a lot of activity related to the WBCs, where there is margination, extravasation. That means they come out of the vascular compartment into the extravascular space, and they move exactly to the site of the inflammation where their action is required. That is under the chemotactic force, because of the chemical mediators that have been released by your WBCs, platelets, damaged tissues, etc. And then these WBCs, once they reach there, they are going to phagocyze, they are going to engulf karte hai wo particles ko. They are going to engulf and destroy it, right? So, and this finally is going to be followed by initiation of the tissue repair, and then finally resolution and recovery. But if there is this recovery is lacking or slow, then the acute infection that had started, or the infection which started as an acute infection, goes into the chronic phase. Ma'am, the next slide, please. So these are the changes. You have the regional and the systemic changes. The regional changes are divided into the vascular and the cellular components. The vascular include the vasodilatation, increased permeability, and stasis is where the blood is actually going slow through that area because of the vasodilatation. And the cellular events are mainly related to the WBCs, the white blood corpuscles, where they marginate, they emigrate, move out of the vascular compartment under the chemotactic force, move to the area of infection, phagocyze, and uh, do away with the harmful stimuli or the organisms over there. Whereas the systemic changes related to inflammation would be leukocytosis, that is, of course, increased WBC count, fever, and increased plasma proteins, because these plasma proteins are going to help out in the entire process of inflammation as regards the chemical mediators. Ma'am, the next slide, please. So this is just the diagram showing you the chemotaxis where the WBCs and the other damaged tissues are releasing certain substances which are attracting the WBCs to the site of infection, and opsonization that we talked about, where the WBCs or the complement system is helping in covering the antigen so that they become more susceptible to phagocyze, to be phagocyzed. Right. The next tissue, ma'am. Slide, ma'am. The molecular mediators of inflammation are a large number of molecular mediators are released by the mast cells, by the WBCs like the macrophages, the lymphocytes, the activated plasma proteins, and the lipid mediators where they are which are responsible for the pain, fever, and the chemotaxis. So these molecular mediators are basically responsible for the increased permeability, the vasodilatation, the tissue, what do you say? I'm sorry, the increased vascular permeability, and these changes and the chemotactic force, all these molecular mediators are helping out in inflammation in this manner. The next slide, please. So this is just another slide showing you that if the stimulus results first in acute inflammation, and if that fails to resolve, then it will turn into chronic inflammation. And this is the chronic inflammation is important. Next slide, please, because this keeps this is a low grade, low immune response where the body is continuously sending inflammatory signals, and these are going to damage the healthy tissues and the organs over months and years. So this anti-inflammatory action of Rhus Tox is regarding, or in case of both acute as well as chronic inflammation. Acute, where the pain is not controlled or it is disturbing the day-to-day activities, therein we would use Rhus Tox. Or chronic inflammation, where it is harming or it is disturbing the daily process. So in case of arthritis, musculoskeletal pain, sciatica, skin infections, herpes infections, urticaria, these are the areas where the Rhus Tox is acting in a very good manner. Next slide, please. The next action is the immunomodulatory action, where immunomodulation is where there are certain substances which help your immune system to work effectively. Sometimes the immune system misfires, is not able to understand that it has to now increase the immune response or decrease, and that time you have these immunomodulators which are classified into immunostimulators and immunosuppressors. Immunostimulators will increase the immune response, like say in cancer, where the cancer cells are supposed to be controlled, their growth has to be controlled, whereas immunosuppressors would suppress the immune response, like in autoimmune diseases or organ transplants. And Rhus Tox in this relation is a very good immunomodulatory action, because it has a dynamic action in the terms that when required, it will act as an immunostimulator or as an immunosuppressor. Right? The next slide, please. The last thing that I talk about is the oxidative stress, where the harmful effects of oxygen is going to result in an imbalance between the free radicals, which are unstable oxygen containing molecules, and the antioxidants. The antioxidants are important because they neutralize the free radicals and their harmful effects. So you can see the causes of oxidative stress, the air, water pollutants, the fast food stress, etc., alcohol, etc., smoking, etc. And the effects that you see, you can just go through. What I am highlighting on is the skin, immune system, and the joints. Please go through that because that is the uh, preferred action of Rhus Tox. That's why I'm asking you to go through that, maybe. The next slide, please. So the antioxidative functions of Rhus Tox are found to be effective in neuropathic pain by reducing the by restoring the antioxidant systems and reducing the oxidative markers, and it's closely related to the anti-inflammatory effects. That's all from my side. Thank you so much.
Thank you very much, Sakeena madam. Now I'd like to call upon Dr. Archana madam to continue about the physiological action of Rhus Tox.
Yes. Good afternoon, ma'am. Thank you so much. Concerning with the physiological aspect of Rhus Tox, I'm talking about the edematous condition, the pain related with the arthritis and all. So let's begin with the anti-edematic action of the Rhus Tox. So first we should know what exactly the edema is. Edema means the accumulation of the fluid in the body tissues, and means the abnormal accumulation in the interstitial spaces, and that actually normally physiologically it is maintained with the Starling's principle. So Starling principle is related with the hydrostatic pressure, oncotic pressure. In our body, basically the hydrostatic pressure pushes the fluid out of the capillaries, and oncotic pressure which pulls the fluid into the capillaries. So these two forces maintains the normal fluid exchange, fluid shift, and if it is disturbed, that we generally called as the disruption in the Starling principle. Edematous condition, the arterial end and the venous end. So here the pressure changes occurs generally. Arterial end, the hydrostatic pressure is greater, and venous end, the oncotic pressure is greater. So next slide, please. So after edema is what exactly that we feel the visible palpable swelling. So we should know fluid shift, the interstitial saturation. So for that, when the fluid leaves the capillaries and enter into the interstitial spaces, so that everything is maintained in relation with the Starling's principle. And the tissue gel and the matrix absorb the certain amount of the fluid, but when it get excess, so it get drainage out with the help of the lymphatic system. And if there is more saturation, then the visible palpable swelling occurs, and that we called as a pitting and non-pitting type of edema. This is the types of the edema. In whenever there is a disruption in the Starling forces, so we can see in the diagram here I mentioned the normal and edematous condition in our body. Normal, the blue arrows indicates that how the enter the hydrostatic pressure and how it get rid of the fluid. So here both the pressures are important, that normally, but when the Starling equation and the forces get disturbed, so increase in the hydrostatic pressure here and decreased in the oncotic pressure. So because of that, the vascular permeability is increased. There is a fluid retention, and more fluid get accumulated into the interstitial spaces, and that leads to a edema. This edematous condition is, next slide, ma'am, important because Rhus Tox is having the very specific action in concern with this edematous condition. Next slide, please, ma'am. So what exactly here? In edematous, we should know what are the inflammatory regulatory protein, and that concerning with the interleukins, and these interleukins are the important substance that maintains the vascular permeability and endothelial structure. Whenever their forces get disturbed, and that cytokines and the interleukins that change the uh, structures of the endothelial cells, and cytokines basically makes the endothelial cells leaky, and due to that the more fluid and the protein get leak out into the interstitial spaces, and finally there is a disturbance into the balancing about the fluid, which leads to a edematous condition because of the high vascular permeability. So this is about the Starling's equation. Next slide, ma'am. So here I mentioned how the leaking occurs. So this is the normal capillary function and the structure, where normally the functions occurs in relation with the Starling's equation. But when the disruption occurs, so edematous condition, so you can see here how the leaking occurs. And that leaking means the accumulation of fluid abnormally into the interstitial space, and that leads to a increased vascular permeability. And here we can see how the edema occurs. Yeah, here the leaking start. So we can see the picture, the swollen hand or a swollen feet. And this is the normally where the permeability is maintained. So as anti-edematous condition, the Rhus Tox maintains the cytokine action. Normally the equation should be maintained, and whenever there is any edematous condition, so Rhus Tox has a very specific action on the cytokines. Change slide can be. So the previous one is about the edematous. Now we are talking about the anti-analgesic effect of the Rhus Tox concerning with the pain pathway. Normally we feel the pain with the help of the receptors, and that we call that is nociceptors, and the perceive the pain and the degree of pain related with the pain pathway. So pain pathway and CNS has an relation. So nociceptors are act through the pain pathways, and the neurotransmitters and synapses which we feel the pain, that is through the CNS, both interlinked to each other, and they maintains the pain concerning about the signaling. So during the pain or any inflammatory condition, the biochemical pain mediators are released. These mediators are important because these are the signals that signals release at the tissue damage or where the inflammation occurs. And these molecules generally activates the nociceptors. And that nociceptors, we know that these are the pain feeling receptors, and that propagating the pain signals, and this maintained through the another key mediators, and that we called as bradykinin, prostaglandin, cytokine, histamine, serotonin, and substance P. So all these are key mediators, and these mediators are important to how they work in our body. And the Rhus Tox has a very wonderful effect on prostaglandins, the cytokines, and the bradykinin. As the bradykinin is a vasodilator, strong and powerful vasodilator, the prostaglandin, which synthesize arachidonic acid, and it acts through the COX enzyme. And when these key indicators are released, it stimulates and sensitizes the nociceptors receptors, and thus how we feel the pain. And in concerning with the substance P, histamine, serotonin, so this gives the vascular changes and stimulating the nerves. Next slide, ma'am. So related with the pain physiology and all, if the Rhus Tox, so we should talk about the transduction, transmission, modulation, and the substance P and the perception. These are the 4 stages through pain pathway we feel. Transduction, in that actually the sensory nerve endings stimulation, of course through the nociceptors, and which occurs at the tissue damage. Transmission, these are the electrical signals that through the PNS, that is the peripheral nervous system. Modulation and the substance P. Whenever there is the pain signaling and the involvement of the neurotransmitters like the endorphins and all, so the pain pathway acts through this modulation. And finally, we get the perception, that of course through the brain signaling, which result in the conscious awareness of the pain. And on the basis of that, through the pain pathway, the pain type are the chronic and the acute. So Rhus Tox helps to relieve the pain by acting these pain mediators and the blocking the release of the prostaglandins and the cytokine that acts actually through the inflammation and releases when there is a signaling occurs. Next slide, ma'am. So the all about the pain, and that the pain through the pain pathway. Now next is the anti-arthritic effect of the Rhus Tox. So everyone we know that what the arthritis is. Whenever there is one or more joints are involved, which leading to pain and associating with the symptoms that we called as arthritis. It is more common in older people, and the arthritis mainly involved with the inflammation, cartilage, and the some fibrous tissues where the damages occur. And we know that the types common, it is osteoarthritis and the rheumatoid arthritis. So being a common osteoarthritis, here the cartilage involvement, the joints cushioning, that the breakdown, the white fibrous tissues and all get involved. So here the same with the rheumatoid arthritis. Here we are having the picture, what is the difference exactly about the osteoarthritis. Here the change, and rheumatoid arthritis, which is autoimmune and that attacks directly the joint involvement. The third is gout, where the uric acid deposition, and the psoriatic arthritis. So whenever there is an infection and all, so joint get involved with the ligament and the fibrous, and Rhus Tox having the action strongly on the white fibrous tissues, and which maintains the arthritic pain by blocking the some key indicators, pain indicators, to stop the release of it from the cells. Next slide, ma'am. So with the concerning with the arthritis, we are having the symptoms like a joint pain, stiffness, swelling, redness, decreased the range of the motion and the fatigue. And Rhus Tox will cover all these symptoms very well. And here we are having the grating sensation also, so that the joints rubbing, the bones rubbing each other, which reduces the mobility, and which causes the swelling and stiffness because of the some the decreased in the activity of a person. So these are the arthritic symptoms. Next slide, ma'am. Now related with the arthritic pain, so the mechanism is basically like that. We know that the nociceptors, which gives the sensation, perception of the pain. So whenever there is an inflammation, bradykinin and prostaglandins lowers the activation of the joint nociceptors. Through that, we feel the pain. And most important thing is that in healthy joints, I mean, if there is no pain, there is inactive functions of the unmyelinated C fibers. But whenever there is an inflammation, so these C fibers get activated and we feel the pain. And all this mechanism is related with the structural breakdown and the movements, shear stress causing the damage to the tissues, and which activates the mechanical ion channels on the nerve terminals. As this is most important, where the Rhus Tox will act properly. And concerning with the muscle pain, in arthritis, we are having the symptoms like fibromyalgia, myositis, rheumatic polymyalgia due to the muscle protein degradation, and which is very common in arthritis, and that's how the stiffness occurs, and restrictions in the joint movement. So ligament and the tendons also, where the wear and tear mechanism occurs, and tendinitis occurs where the tendons becomes inflamed. So, and this occurs due to the overuse and arthritis. Usually the joint pain arises through the sensory nerve. If we are concerning about the physiology, the pain pathway and all, the sensory nerves are involvement through the nociceptors, and which causing the damage to the joint tissues. The ligaments, the functions get disturbed, which due to the trauma, inflammation, and there is a structural damage. So this peripheral sensitization mostly occurs through the cytokines and the prostaglandins. And this is important how the Rhus Tox will act. And this all will going to explain with the Deshmukh ma'am. Next slide, ma'am. So in the last, how the Rhus Tox will act related to the all anti-edematous, the anti-analgesic and the anti-arthritic, as the inflammation, Sakeena ma'am told the mediators and all. So edematous structural damage and stiffness, arthritic pain, which Rhus Tox generally act well by blocking the all pain mediators. So when the movement improves with the movement and worsen with the rest. This is the peculiarity of the Rhus Tox. Thank you. Now, the next is continue with the Dr. Ranjana Deshmukh, ma'am. Thank you, ma'am.
Thank you. Thank you very much, Dr. Sakeena madam and Archana. You have very nicely explained about physiology because without physiology, no one can understand what is pharmacological action. So thank you. So if we come to see that there is anti-inflammatory action of Rhus Tox. Here the what is Rhus Tox is produced, that is Rhus Tox is having arachidonic acid which converts into prostaglandin, and this is because of presence of cyclooxygenase. But when Rhus Tox is given to the patient, the Rhus Tox molecule, it acts like competitive enzyme, and and it can't able to convert this arachidonic acid to prostaglandin, because of which the inflammation takes place. So it controls both the sides, that is which the conversion of prostaglandin or when not converted. The Rhus Tox molecule that controls the conversion, and so it is not able to produce, will not allow to produce cyclooxygenase molecule, and thus the anti-inflammatory action through the Rhus Tox takes place. Now we will come to see the anti-edematous effect. So in anti-edematous effect, if we come to see, next slide please. What is edema? Edema is produced because of histamine or bradykardin or prostaglandin. Here, what does the Rhus Tox is, it reduces the capillary permeability and it produces the accumulation in the tissues. So normally the lysosomes which releases proteolytic enzymes during inflammation, which damages the tissue and increases the edema. But by preventing this enzyme by the Rhus Tox, that is which is released, and by the extract of Rhus Tox, the tissue integrity further limits the swelling, and thus the anti-inflammatory action takes place by the Rhus Tox. Now we will come to see that is what is pain or how pain relieves. That is next slide. The analgesic effect. If we see the analgesic effect, same as an anti-inflammatory. Next slide, please. The Rhus Tox inhibits the cyclooxygenase enzyme, which reduces prostaglandin formation, and thus the Rhus Tox reduces the pain. That is, and it gives the analgesic effect by the Rhus Tox. After that, we come to see, it is also having the antioxidant activity. So when inflammation takes place, there is release of many radicals like hydroxyl radicals and some superhydroxyamine radicals, which they are highly unstable radicals. Thus the Rhus Tox act as a free radical scavengers, and it donates the different electrons or hydrocarbon atoms, so it prevents the cellular oxidation, and thus the Rhus Tox acts as an antioxidant. Now we will move to immunomodulatory effect. Next slide, please. In this immunomodulatory effect, those individuals whose immunity is hyperactive, the Rhus Tox controls the hyperactivation by T lymphocytes. So along, previous slide please, immunomodulatory. So along with this, its antioxidant properties, which reduces the stress, that is oxidative stress, which is linked with immune activation. And through this mechanism, whole mechanism, the Rhus Tox, which suppresses exaggerated inflammatory responses and maintains the immune balance. Thus, Rhus Tox gives the immunomodulatory effect. Now we will see the anti-arthritic activity of the Rhus Tox. Next slide, please. This Rhus Tox, it inhibits cyclooxygenase enzyme, thus reducing prostaglandin synthesis, and which reduces the pain and swelling. But when patient comes, he comes with the pain, swelling, and damaged cartilage. So Rhus Tox extract or Rhus Tox, it controls and it gives the own electron to the tissues, and it controls the pain and damage of the tissues. With this, when we come to see, it gives a support therapy, that is like calcium or phosphate. With this Rhus Tox, we have to give supportive therapy, that is in chemical form or in biochemic remedies, we give calcarea phos. So if we administer with Rhus Tox, the calcarea phos 6x or 3x, it will be a supportive treatment. So like this, Rhus Tox is also act as anti-arthritic activity. Next slide, please. These are the different actions of Rhus Tox. And if we see that which part of Rhus Tox, that is we take leaves and we prepare, its preparation is through the mother tincture, that is with alcohol we prepare mother tincture, and specifically Rhus Tox mother tincture is prepared according to old Hahnemannian method. It is in class 3. So though as the class 3 drug substances are least juicy, we have to take double quantity of alcohol and then we have to prepare mother tincture. So for preparing mother tincture, we have to take the original drug substance, that is leaves, with the its coarser powder is prepared, and the ratio is given in your slide. You can see it. If we take 100 gram of this coarser powder, we will take menstruum, that is combination of purified water and alcohol, that is 200 ml of purified water and with 824 ml of alcohol. When we mix it, it is called a menstruum, and which acts as a best menstruum because it dissolves the active principle of your Rhus Tox, that is eucerol and the active properties which act on your tissues, and thus we can apply mother tincture also in some people, but it is not given to each and every patient. But mostly we apply the potencies, and that potencies, some people who are suffering from chronic diseases, we start from lower potency. And if we want to prepare different potencies from the mother tincture, that mother tincture, from the mother tincture we prepare according to different scale. That is, if it is here in the slide we have given that in decimal scale, if we want to prepare, as the drug strength is 1/10, second potency can be prepared by taking 1 part of previous potency and 99 part of alcohol, giving succussions. We prepare different potencies. Like this, we can prepare different high and higher potencies, and we can apply according to the stage of disease of the person. So next slide. Like this, we have seen the different actions, and if we see pharmacodynamics of the Rhus Tox, it is having different actions, that is mechanical action, chemical action, and dynamic action. Each drug is having its chemical affinity. Because of its chemical affinity, that is, what is chemical constituent present in Rhus Tox is eucerol. It is an active form of a chemical present in Rhus Tox. It acts or it triggers the allergic effect or inflammatory reactions on the body, and which leads to different symptoms of your skin like eruptions, itching, or redness, and the patient becomes restless. So it is a chemical affinity of the Rhus Tox. If you come to see the mechanical action of Rhus Tox, the mechanical action is that is mechanism, how the drug acts in a different manner. That is, if we see the skin, it releases the eucerol, which is it creates the irritation in the body, and it forms a redness, itching, burning, and swelling on your part. That is what the mechanism, it acts like that on your body. It shows symptom like that. And the dynamic action, third is dynamic action. Basically, dynamic action is the action which takes place when we give the potencies to the patient. And it is studied according to different materia medica, but when it acts on in the form of primary and secondary action. So primary action is always action of drug on human, the drug on the body, and the secondary action is the action which is of two types, that is secondary counter and curative. When first reaction exactly opposite to the primary action is secondary counter action, and last action is secondary curative action. Like this, different actions of Rhus Tox take place. And finally, when we administer a Rhus Tox, by knowing the normal physiology and then the pharmacological action of Rhus Tox, it acts very nicely on the patient when we take a symptom similarity and totality. With that, we cure different patients by Rhus Tox. So like this, we come to see that physiological and pharmacological action of Rhus Tox in this webinar. Thank you. Thank you very much. Aisha, madam?
Thank you very much, madam.
Thank you very much, madam.
It was a very interesting session, a very refreshing one. Like, we all have studied materia medica a lot about Rhus Tox, and we have get to know about a different perspective, very different perspective about Rhus Tox, how its action is taken, what are the effects that we can use it. So my question is how it can remove edema. What is the physiology on application of Rhus Tox on edema?
Yes, ma'am. Basically, edema is where in interstitial spaces abnormal accumulation of the fluid. So that accumulation occurs due to release of cytokines and prostaglandins, due to imbalance of the Starling's equation, hydrostatic pressure, and the oncotic pressure. This is the edematous condition.
When we are giving the Rhus
When
Tox
we are giving
to the patient,
to the
so
patient,
Rhus Tox
so
will
Rhus Tox
directly
will directly
block the
block the
prostaglandin and
cytokines release from the cells, and that's how the Rhus Tox will reduces the edematous condition as there is increases the oncotic pressure, the Starling equation, and to interstitial space and interstitial space to capillary. This is the action of the Rhus tox in edematous condition. And slowly, this edema get decreased and the forces, both the forces get maintained. This is the basic action of the edema, Rhus tox on edema.
Thank you very much, ma'am. And about the arthritis, as Rhus tox is a very well-known remedy in arthritis. So what are the physiological changes on application of Rhus tox in case of arthritis? What all differences we can see?
Yes. During arthritis, as it is associated with the symptoms like stiffness and there is the restriction in the movement. So in arthritis generally occurs whenever there is an inflammation, and whenever there is an inflammation, so the interleukins and the pain mediator, that is the bradykinin, and the same again the prostaglandin, that get released. In arthritis, the action of the Rhus tox, it will stop the formation of the prostaglandin from the arachidonic acid. So this is the direct that arachidonic acid, if the release of the arachidonic and formation stop, no prostaglandin and no pain in arthritis. And also it releases the stiffness also, the muscle protein where the degradation occurs. So Rhus tox, with the help of this pain mediator, it will enhance the synthesis of the protein so that the muscle mass will form, and there is slowly but reduces the stiffness and the arthritic pain. This is the action of the
And even
anti-arthritic of Rhus tox. Yeah, ma'am.
and even the Rhus tox, it releases the cyclooxygenase enzyme, which reduces the prostaglandin. Since prostaglandin synthesis reduces, and then the anti-arthritic effect takes place.
Okay.
Is inhibiting the
Yes, ma'am.
COX-2 enzyme, and then the prostaglandins are not inhibited from being formed, and because prostaglandins are one of the most important inflammatory mediators. So basically, and nitric oxide in which is being formed during inflammation, those metabolites are also being removed. So these are some of the facets to which Rhus tox is acting by preventing inflammation, and thus means the inflammatory mediators are decreased and inflammation decreased. So arthritis is a form of inflammation
Pain is
itself.
relieved. Pain is relieved. Yeah.
Okay. So in case of injuries, inflammation due to injuries, can we apply Rhus tox in the same manner, or is it going to work in the same manner?
No, we can administer even in injury Rhus tox, because there is a damage of tissue, and because of damage of tissue, it may happen that it releases the prostaglandin and cytokinin, and where the inflammation takes place, it creates the swelling and pain. So in that case, we can administer Rhus tox according to the state, and mostly it should be in 200, and we can relieve the pain. And if it is a blunt injury, even we can apply external application, but mostly the internal medicine is given.
Always internal medicine is better as compared to local application, right?
I would like to add a few points to it, that Rhus tox is mainly indicated for blunt injuries, not for cut injuries, and where there are sprains, there is overstretching and muscular damage or damage to ligaments and tendons. These would be the areas where Rhus tox would be best applied and would give best results. We have other medicines which, like arnica, calendula, etc., which are indicated in other different types of injuries. I know I gave the example of a cut, but that was just in reference to inflammation, not in reference to actual Rhus tox, basically.
Okay.
Even the Aisha madam is asking about the muscle injury that is damage due to forceful blunt
Yes.
injury only.
Yes, because we are talking about inflammation, right? Rhus Tox
Yeah,
is very helpful in curing inflammation. So that can be caused from injuries as well.
yeah.
Traumatic injuries mostly.
Yes.
So
Any more
any questions from the participants? We are ready to take the questions. Please type in the chat box. No questions so far?
Okay.
Okay.
I think everybody has got understood what is physiology behind the pharmacological action, and that's why there are no questions.
I think they are very clear about the physiological and pharmacological action of Rhus Tox. Taking up one drug at a time was a very good idea, madam. I'm very thankful to you for initiating this new topic and a panel discussion on Rhus Tox. Thank you very much, Ranjana madam. I'd like to present to you the digital certificate. This whole idea of organizing symposium on a single drug, the credit goes to Dr. Ranjana madam. And you have brought with us a very good participants, a very renowned professionals and teachers who are able to explain about the different aspects of Rhus Tox. Thank you very much, madam. Now I'd like to thank Dr. Archana madam. Thank you very much for having you here. And your knowledge that you have given us is very much insightful. And we could understand the various aspects of inflammation and edema. Thank you very much, ma'am. And I'd also like to present a digital certificate to Dr. Sakeena, madam. Her knowledge of physiology was quite in-depth. So thank you very much, ma'am, for giving us this opportunity to host you.
Thank you.
We are looking forward for organizing this kind of webinar hereafter. Madam, will be very much looking forward to your suggestions.
Thank you, madam. Thank you so much.
Upcoming webinars.
Thank you very much, madam. Because of your support, we are able to give this nice webinar to the student, and we want to share our knowledge with the student, because if we take like this webinars, it is clear that how Rhus Tox acts. So thank you very much for Sympathy Institution and Principal Ayesha madam. Thank you very much.
Thank you, ma'am, for your kind words. Sakeena madam, would you like to say something?
Yes, ma'am. I really found this a very good platform to, reach out to the students. And basically this idea of presenting a drug regarding its pharmacological aspect as well as the like where we are integrating the, physiological knowledge to our homeopathical knowledge. And that's so very important. And that's what we actually all need. The research work that is required over here is what we are like walking into, and that would be really, really helpful for, reaching out to so many students, and there it would ignite some spark and they would, follow these steps. So thankful to the Sympathy Institute. Thanks to you, ma'am, and Dr. Ranjana Deshmukh and Dr. Archana Deshmukh for this wonderful presentation.
We'd like to have a word from you.
Thank you so much, Aisha ma'am and Sympathy Institute, that here we are integrating and explaining about the physiology. So nobody will blindly give the Rhus Tox. Everyone should know the
Yes.
physiology and how it works, basically in inflammation and all conditions. So this correlation with the pharmacy and its dynamics and with physiology. So I feel according to the CBDC and to moving ahead with the therapeutic with the Rhus Tox, so everyone should know this aspect, physiological aspect. And thank you so much for you for organizing this. Thank you, Deshmukh ma'am and Sakeena ma'am, with the cooperation by
Yes,
arranging this.
we should have a good round of applause for Dr. Ranjana madam for
Yeah.
initiating this.
Thank you. Thank you very much.
Thank you, ma'am. Now we would conclude our session for today. Thank
Yes.
you all for being with us.